Hello everybody and welcome to another in the ALNAP network series of webinars around humanitarian coordination. Today's webinar, of course, on the topic of information management, about which a little bit more later in terms of definitions and why we think this is important and so on. The first thing that we wanted to do was to ask if you would kindly complete a poll, just to give us an idea about what the nature of the participation in this webinar is, how much experience you all have in issues of information management. That will give our speakers particularly a sense of who they're talking to, because of course they can't see you in the room. So that brings us on to the speakers. I'm sorry, I'm very rude. I should have introduced myself. My name is Paul Knox-Clark. I'm the head of research at ALNAP. And I'll be chairing today's discussion. And as usual, we have three really excellent speakers to talk around the topic, all of whom have broad and deep expertise in areas of information management. I'll start with Francesco Fresetti, who works as information analyst with ACAPS. He's worked previously with OCHA on the VOSOC platform, and supported information management for UNBDAC deployments. He also worked for several years as disaster management advisor for HRNS, which is Health Ricerca e Sviluppo, also working on information management and analysis. Francesco holds a master's degree in disaster management from the University of Copenhagen, and I must say I'm fascinated by this, a Master of Arts in Educational Models and Techniques for Intervention in Social Unease from the University of Bologna, which I would imagine comes in very handy, Francesco, at cocktail parties. William Chamali is the Deputy Head of OCHA's Regional Office for the Syria Crisis. Previously, he worked as the representative of the DRC, the Danish Refugee Council, in Geneva. And before that, he founded the Joint IDP Profiling Service, which I'm sure, JIPS, many of you are aware of, and headed that team for several years. While he was there, he led data processes in countries including Afghanistan, Burundi, Colombia, Ecuador, DR Congo, Kenya, Haiti, Serbia, and Yemen. So a broad geographical understanding of what it takes. In addition to his humanitarian data focus and global policy work, William served as an emergency and protection expert with UNHCR in Lebanon, Uganda, and Kenya. He earned degrees in economics, in international relations and human rights, and in democratization from the St. Joseph University in Lebanon, the University of Malta, and the National University of Ireland in Galway. Last but by no means least, Cecilia Utas has recently joined UNHCR as Needs Assessment Specialist. She has extensive field experience as Information Management Officer and Assessment Coordinator with OCHA, with UNICEF and with UNDP, and was recently, or last in, with UNDP in Nepal, supporting early recovery after the earthquakes. Prior to this, she served as Chief for the Coordinated Assessment Support Section for UNOCHA in Geneva. So I think you'll agree, a really excellent panel, and we look forward to seeing what they say. So the results, before we go further, just so our speakers as well, William, Francesco, Cecilia, so you know, we have 50% of our participants have been involved in humanitarian information management. 24% have thought about it but do not have operational experience. 12% have been cluster sector working group IMOs. 5% have worked on humanitarian IM at a senior level, and 9% have non-humanitarian information management experience. So it's quite a broad range. Let us go straight into the questions, and maybe Cecilia, I could start with you. For those particularly, we've got a lot of people on the webinar. We might not all understand information management in the same way. I wonder if you could just kick us off by giving a definition, if you like, a working definition of information management.
Thank you very much, Paul, and nice to talk to all of you. So yes, I have this task to define information management, which of course would be as many definitions as information managers we have out there. So, but I would then define it as it is an approach to consolidate data from multiple sources, then process it, interpret it, to create meaning of it. And that, of course, will depend on the purpose of the objectives as well that has been set from the beginning. And then summarize and visualize it in a variety of products that then will be disseminated to decision makers for operational use, but also back to the affected communities as it best. It is key here to define information needs early on with a multiple of stakeholders, particularly across information management with coordination and programming, which I think sometimes is lacking in the field.
Really useful, I think, and comprehensive definition, which also highlights the number of different elements, the number of things that are going on in this information management process. Francesco, a question which may seem obvious, but I think is worth underlining and getting an expert opinion, which is, why does this matter? What is information management doing for us in terms of humanitarian operations? Why should we care?
Thank you, Paul, and thank you, Cecilia, for the great introduction. As Cecilia said, information management is the process to manage and analyze the information. This matters because every single decisions that we usually have to make in our life is based on more or less a range of information that allow us to have an idea of what's going on and where we want to go. So usually decisions are driven by what we know and how we deal with the information that we know, that we have. In the humanitarian sector, this is not different. Like when there is the need to make a decision, which can be where to invest funding or where to direct some operations or how to prioritize need, we need to know exactly what is going on, well, exactly the best as we can, and the information management process has the purpose to actually clarify this view and help the decision makers to make these decisions.
Great, thanks. As you were saying that, I was thinking, you know, this is all about decisions in embryonic form, because this point about decisions is one that you brought up, which comes up quite a lot. So I think probably no ambiguity as to why actually this is at the core of good humanitarian response, but not easy. William, I wonder, you've probably seen as many challenges around this as most. What would you say are the key challenges for information management and information managers in humanitarian contexts?
Well, first, good afternoon, Paul, and good afternoon to Cecilia, Francesco, and all the colleagues online. Challenges, I mean, it's information management, and it is a humanitarian, so it's by definition one big challenge, I guess. But I think I would categorize the key challenges to three main. One is, even though how important is information management as an area of work, and as Francesco said, it matters because, you know, we are a multilateral system that requires to read from one page to decide on something that makes sense. With all this acknowledgement, I think it is still not a priority, and we can still see in every operation information managers are the last kind of profile to become fully available and up to speed in operations. Of gaps that makes it very difficult to come up. I think the biggest challenge is it's not yet as prior should be, or as we speak about it in this environment. The second thing is the ethics of information management. We deal with in context where in many situations all what people are left with is their story, and they tell it to us in a form of an assessment or interview or whatever. And I think we we are living in a place where we should be more and more careful with the ethics of privacy, of information we're gathering, how important it is for the people we're getting information from, and how much it raises expectations. I mean, we look at assessments, for example, as a technical exercise where you have an as a humanitarian, and when the story is told, it comes with responsibility. And I think while much of the local NGOs and our partners who are on the front lines understand that more and more, I think this gets diluted sometimes. The more distant we are from the field and the bigger the systems are. I would limit it to for now to these two key challenges. Over back to you, Paul.
Thank you, William. And I think we'll pick up on those. I mean, those themes will keep coming back, I would imagine, over the course of this conversation. I'd like to go back to where you started with that. You talked about, this being a multilateral system with many different organizations who we all want to be reading from one page, and certainly one of the issues that seems to come up quite a lot in information management at, if you like, the collection part, maybe the collection and analysis part, is that you've got all these different humanitarian agencies with very different assessment or monitoring systems, information collection systems, which are not necessarily coordinated very well. And this, I think, has been picked up in the WHS and elsewhere as a real problem, that multiple uncoordinated information collection through assessment and monitoring. And we've seen various sort of approaches to address this. I wondered, Cecilia, from your experience, with respect to this problem, what are the different approaches and their relative advantages to dealing with this? And how do you think the humanitarian system should move forward? What are the next steps?
Yeah, I mean, obviously that is not such an easy question to answer. If that was the case, we would probably have been doing much better as we've done so far. But I do think that maybe the first key step would be that we're improving the planning from the onset. And that would be within the cluster, that we have a discussion of what are the information needs that we really need to address, to understand, and also monitoring as the emergency proceeds, but also on an intercluster level. And I think we need to then establish those needs and ensuring that we have a much more predictive and predictive system that has more comparable data, which will help us with the analysis. That will, of course, as well help us to some extent also deal with the bias of the information that we keep coming back to, as we also are looking at the need of having more unbiased analysis from more impartial actors. But the more we can have methodologies established from the beginning, then, of course, the output of the analysis would be more, or not being automatic, but be basically derived according to certain systems that have already been set in place and predefined. So I think it's important to acknowledge that there's been very clear guidance a long time back, since 2012, the operational guidance on coordinated approach for needs assessments, for example, which clearly is stating how would be the best way to go forward, because we need to acknowledge that as long we might need to be able to one single assessment to understand the needs and situation data for strategic decision, but that information will not be good enough for operational decisions and programming. So in that sense, we will always be in a context where we will have multiple assessments, and we cannot rely on having only just one single assessment or joint assessment in that sense. But what we need to ensure is that they're coordinated, not uncoordinated. Basic for that will, of course, be that we need to be better at sharing data. We have been saying that for years, but we can still see that it's not happening in the way we want, and there's often good reasons for it, but we need to look at the hiccups for why we cannot do that in a better way. But also, it's not enough to just share the data if you're not sharing certain standards standards when it comes to what units to use, geographical or others. We need to also having partly standardized methodologies so we can compare the information coming out of the different assessments and exercises. Operational procedures need to be standardized, and also looking at how we can have some core data sets or core information needs that we are sharing, like indicators that we can ensure we have the data from. From UNHCR sides, we are looking at improving it from that aspect. So we are having two parallel initiatives. One that is basically to ensure that we are setting an analytical framework in the onset of any operations and an emergencies, which then will somehow have an effect both on all UNHCR operations but also the clusters. This will help us to do exactly what I was mentioning before, to establish our information need, analytical questions that we need to answer, and it will also help us to integrate both the needs but also the response, which is of course key to link the indicators between need situation and output indicators from the response to both outcome and impact indicators. So, and the other thing is as well as an initiative going on right now that is protection information management, which is a principled and systemized and collaborative approach to information management, which will enable evidence-informed action for quality protection outcome. So it's basically 20 or so partners that is going together with that UNHCR is collaborating with DRC, NRC, Oxfam, UNICEF and others. So it will help us to have a better understanding of what is needed for protection and information management. And protection in that sense is also one of the issues that need to be better streamlined through all of the response, and will also be helpful wider than to protection practitioners. So the idea there is, of course, to have a structure and principle standards, to create shared dialogue and foster cooperation, to develop the space and culture for sharing data, and to provide quality information and data on protection issues. So, so that will help to some extent. I will leave it at that point there, as it was mainly what I understood focused on intra-cluster, and of course there's much more to say on the inter-cluster level on this issue.
Thank you there, and thanks for queuing up the next question so well. I wonder, I believe, is the protection information management project, is that available online? Is there information, do you know, Cecilia, available about that online? Because I'm sure a lot of our participants would be interested.
Yes, I must say I'm not sure if it is online yet. It's in a pilot phase now, and there should be possible to share information about it. I need to come back exactly where to find that information at this point. But it has been piloted both in Ukraine and I also think it was in Lebanon, and as a kind of a training model as it is there, but more in a workshop format. And what I really like for that, because I think all of us have been working with capacity building over the years and have more traditional trainings a week long with maybe 20 to 30 practitioners from the field, but then go back to different field missions, have maybe not as much impact as we would like, as obviously then you're coming back with good new ideas, but no one else is actually having the same understandings as you. While the purpose of the PIM, or the way that the capacity building part of it is working, is to actually have both coordinators, protection officers and information managers in the same room from multiple agencies, and then together is looking at how they can actually address information management and going through a systematic approach and coming up with an action plan by the end of the week, which we can already see from the Ukraine experience that it's actually have had an impact of how they would like to take their work forward.
Fascinating, and I think we'll probably come back to this in a minute when we talk about the uses of information, a point you made earlier as well, Cecilia, about the importance of actually having information which is answering the questions that people need answered. So let's hold on to that thought. Also, we will try and find out what's available there and send it around to participants as well. But Cecilia did a marvelous job of queuing up, because we've been talking very much about the harmonization, the difficulties of having lots of different agency approaches, but of course a lot of work has been done at the level of the clusters as well, and the protection work involves the protection cluster, but also WASH cluster and many other clusters have done a lot of work around information management tools, information management approaches. William, you work at the level where all of this comes together, so the sort of intercluster area of information management. And I wondered from there if you thought that generally there's a need for harmonizing the different approaches coming out of the different clusters and the different tools. And if so, you know, how this might go forward, and perhaps more broadly, how you see intercluster information management going forward.
Yeah, thank you, Paul. Yes, I mean, I think first is there needs to be, I think, a harmonization of a culture of openness and data sharing, as well combined with kind of humbleness in the sense of being not clear about the limitations of the data that we have in the clusters in general, and not make, you know, the great enemy of the good and be restrictive in sharing data because it's not excellent nor good enough. And I think at the base of this, I think we see a growing trend of data sharing and openness, but as Cecilia said, we still see resistance in general, and that's built in the concept of this is a cluster data or an agency data or my data or your data. And I think just the more we can create a culture across all clusters, globally, locally, that of openness and data sharing, I think most of the problems would be resolved. However, flooding of sharing of data creates a different kind of challenges. And I think, personally, where I've seen these systems really work well is when the cluster actually focuses on improving operational efficiency and timeliness. So clusters locally and by at the same level globally should really build their systems to be operationally efficient, operationally fast, and respond basically to the needs as soon as possible. Now, so the thinking shouldn't be how do we collaborate better, but for clusters to do their jobs well, they need to work with other clusters. I mean, health will have to work with nutrition and water sanitation, to take a minimalistic example. And this is where it's interesting. I think at the global level, the more they can minimize recreating the wheel at the field level for simple things, basic standards, basic definitions, that allow clusters to work together operationally on the ground, the faster this work goes, and the less people are really thinking to creating when the operations are going. So I think first thing for the global clusters to harmonize is really some basic standard definitions, and we have very good attempts to do that through the CODs and the FODs, the Common Operational Data Sets, and these help a lot on day-to-day collaboration at the field level to make sharing of the information actionable, and makes the difference on the ground. The second layer where global clusters could be of help, and there is many attempts and successes in doing that, is basically setting up a common strategic analytical framework. What we don't need is a centralized system that everything is aligned. That will not work. It hasn't worked, and it ignores the specificity of how every cluster responders actually think. We should maintain that. We should make them more efficient. But when all this information comes together, we need a strategic common analytical framework. And there are several attempts to do that. creating a standard or a harmonized set of measuring severity of needs in a location. That allows, if it is comparable from sector to some extent, that allows prioritization, that allows knowing where the focus should be. Having a analytical framework that allows us to identify gaps at an intersectoral level, that also helps in decision making on the ground in the strategic direction of operations. So my answer, again, back to the basic question, I think every sector should do their best to focus on their operations as the most important thing. But I think to do that very well in a complex environment where you have multitude of needs for every location or people, we need basic definitions to be acknowledged and not to be created every time. And we need analytical framework to analyze where things should go in measuring severity and identifying gaps that are comparable across sectors overall.
I wonder if, I'm putting all three of you on the spot here, but starting with you, William, if you've got, I mean, obviously this idea of this analytical framework, which is not entirely prescriptive, which is not a sort of necessarily a joint thing, which everybody follows, but is a way of taking different data and putting it together into a picture that shows gaps and so on. Have you seen good examples of this? And particularly, actually, one of our participants, Philip Domingo, hello Philip, has asked whether we have examples of harmonizing frameworks which harmonize particularly qualitative data, so sort of data from feedback from focus groups, which can be rather more difficult to put together. So first of all, William, do you have any examples of where this has worked?
I mean, I can take the example of the current operation I'm working on, and that's not the simplest operation. I work in the Syria crisis, and the challenge in Syria crisis is you have operations happening inside Syria, but launched from 5 different operational centers. Some operations are launched from Damascus, from Amman, from Gaziantep in Turkey, from Lebanon, from Iraq, and you have clusters set up in these different locations. So if you take the protection cluster, for example, we have about 25 coordinators for the operation because they're based, they're leads and co-leads and sub-cluster based in different countries and trying to work together. So what we tried to do is to create this kind of simple severity scale system where every cluster identifies basically a scale for how severe is the situation for their cluster in a location. So for WASH, for example, if a location has more than half of its population as IDPs, it means the water situation is terribly bad because the systems in place were not built to serve as many people, for example. And when we look at this severity scale example to address the question, one of the issues we look at is what is the coping mechanism of the population in dealing with how dire the situation is. And basically all sector members would sit together with people who are knowledgeable on the ground and debate using a Delphi method of experts, focus group discussion basically, to reach a consensus on how to describe the situation. And this severity scale, which is usually based on 3 or 4 indicators per sector only, has the same structure across all sectors, which allows adding it up on top of each other and comparing geographic locations. We recognize it's way too simplistic to describe how the situation is for a sector and across sectors. But however, it allows the communication to flow in a structured way between the different components of the response. And sometimes you have to go for very simplistic solutions, recognize the limitations and go for it. And I'm happy to share this kind of the pack of this work that was done last year and repeated this year. And I have to note that I know at the global level, ACAPS, maybe Francesco can talk about it, is trying to work with OCHA to come up with a global frameworks for severity scales that could become the starting point for people in countries working on operations overall.
That's great, thank you. Yes, if you did have anything that we could share with participants, we could send it out afterwards. That would be marvelous, William. Thank you. The other one that comes to mind, of course, is in this area is the approach taken by the International Phase Classification System, which many of you will know, which also is a way of taking different data sets which haven't necessarily been designed to be interoperable and putting them together using a panel of experts, and that might be something that is interesting also in this context. Francesco, William opened up this question. I don't know if you wanted to add anything to what William said about the joint ACAPS-OCHA work.
Well, I don't think there is that much to add. Yes, ACAPS have been working for quite a while on developing some standard way to assess severity scale. And also we're working on more that you will probably see in the coming months to perfection our methodology also at other levels of analysis. One thing that I would like to add more on the ACAPS side is that one situation in which like a joint work on assessments and information management has worked well on ACAPS side. Another one was the work on joint needs assessment and data preparedness that ACAPS did on for 2 years and more in Bangladesh on developing and supporting the joint group that worked on collecting data, and especially baseline data, because one of the main key points that I would like to raise is that information management shouldn't be, and analysis shouldn't be an approach and a work undertaken of an approach that provides regular ensure also a good base of baseline data and data preparedness, because thanks to the work of the partners and of ACAPS in Bangladesh, the rapidity and the speed to which now it is possible to perform assessments in Bangladesh for the group has improved incredibly.
Thanks, Francesco. I think that Bangladesh example is a great one because, of course, as with so many things in humanitarian action, by the time the emergency arrives, it really is a little bit late in many cases to be collecting baseline data. And so, certainly something that that ALNAP has picked up over the years is really the need to be establishing these long-term data sets about fairly simple stuff around demographics and population location, so that these can be used in a situation of emergency response. I wonder, William, actually, if you have any additional examples on this, because I think this is an issue that you'd brought up, the importance of using the CODs and the FODs and establishing these basic data sets.
I mean, I guess for any kind of communication between organizations or clusters, having really the basics definitions put in place is foundational. Otherwise, we can have I'll give you an example. If we have two organizations assessing a location, and one of them is saying in this location we have 2,000 households, and the other organization saying we have 2,300 households. The truth could be that they're both right. They just define households in a different way. One looks at households as people sharing a meal every day, and the other, which could be typically food security sector. The other one looking at the household as people living under one roof, which could be typically the shelter sector. So I think to illustrate that the room for confusion could be great if we don't have the basics of the definitions really put in place and available in a useful way for everyone. And this is where the CODs and the FODs comes pretty handy. And yeah, we encourage all partners to contribute to them around the world. And they help in running operations and preparedness for operations, and at the end, in closing down operations and handing over to more development kind of activities. Over.
Thank you. So all of you who are out there, and I'm sure you're all, or many of you are doing this anyway. But if you're not, please work on the long-term and the basic data sets. It seems to be an area of particular importance. I've just actually had an internal note through the magic of webinar, which is from Francesco, just saying that he had some other points, quite important points to make about this. So over to you, Francesco.
I just wanted to clarify that unfortunately, sometimes it happens that the mindset, as you said in the introduction, is still a little bit not there to provide a good basis for the work of information management and analysis, but it's the good collection of baseline data, if done thoroughly and constantly, and the mapping and the data preparedness can actually allow to support operations and to support the understanding of a crisis, also in situations where access fails. Because if we consider, for an example, an earthquake where on remote mountain areas and the infrastructure fails and they're not reachable, having good baseline data can allow to estimate more or less the range of population that might be in need, can allow other kind of assumptions in a more, in a more reliable way. And on the other hand, having a good baseline data allows for a good comparison when a disaster strikes, when there is an emergency, allows to compare the after with the before. And I think this is the point that is very important, because in our opinion, having a good methodology and a good approach and working on information should be a job that doesn't stop with the emergency, that doesn't stop with the response, but it's a constant work.
Indeed, thank you. And again, this brings up this point, which I think has only become more and more salient over the last couple of years around the WHS, and certainly came up a lot at the ALNAP Global Forum, which is that humanitarian work is not working in a bubble, and we need to be thinking about the way that we relate to, obviously, the systems established by the state and also systems established by developmental actors, and information is a core part of that. I'd like to move back, actually, go forward by moving backwards to a point that came up earlier on, and which I don't know if this was true of those of you who are participating, but I was very struck by William's statement that sometimes all stories and the sort of the importance flowing from that of ethics and ethical approaches in information management. It was one of the two big challenges William pointed out. It's perhaps something which hasn't received as much attention in some of the more technical discussions as other areas. It is, I know, and Cecilia, I know you've been involved in this. It is, I know, something which the protection information management process is focused on. I wondered if you could tell us, from your point of view, the UNHCR point of view, and your other experience, if you feel that there's a need to prioritize improvements in ethics around the information management, and what needs to be done, perhaps, if so, what needs to be done, how we might do it. Cecilia.
Yes, I think that we are in a similar situation as a lot of other things. I mean, there is a lot of guidance out there on data protection. So in that sense, that the awareness is there, but I also think that we are working more and more in situations which is involving conflict displacement, where of course there's a greater sensitivity around the information, especially if it is disseminated externally. And I do think that often as information manager, we might not be as aware of what could actually be harmful or put the beneficiaries in a harmful way, due to what we maybe sometimes look at as very harmful information. So it could be as easy as disaggregated information could sometimes be a problem to release, but it could also be, for example, an example from Iraq was an organization was publishing a map that highlighted ethnic and religious groups within a site plan, and that is something that you really need to look into from the perspective of sensitivity. So yes, I do think that it's a need to maybe revive that discussion and always be very aware. And I think there will always be in any operation, there will be protection officer that would have that understanding and could very easily then discuss with the information management working group, for example, to ensure that we are making sure that we are protecting our information sources, we are having a protection-sensitive approach. So when interviewing our people, we should need to be mindful about how they've been suffering experiences before, and also making sure that who is actually listening in, etc., to those kind of interviews. So I think there's a lot of things that we can do. And of course, we are all aware, I think, about confidentiality and informed consent. And I think that is very much a key thing that is happening in any needs assessment, that we're ensuring that we have that as a basic question when we're going out and interviewing, particularly in a household level survey. But that's a basic need to be in place. And also safeguarding the recorded information, where of course sometimes you're using that, I would say, as an excuse not to share data, but that's why the data sharing protocols is going to be crucial to ensure that we have certain amount of confidentiality among certain data that we can still share with partners, etc. But it needs to be regulated maybe in a better way than it is today.
Great, thank you, Cecilia. What comes to me as from that is, of course, the fact that this issue, this ethical issue, runs all the way. You earlier on you gave us a very clear kind of statement of the breadth of the information management function, and what comes to me from that is the importance of these ethical issues around protection, around do no harm, around informed consent, being present at the collection phase, at the sharing, storage, and presentation. So I think this idea of talking to protection specialists in particular, and really looking at the whole information management process through that lens is a very powerful one, and one that it would be very interesting to know if anyone on the participant group here today has any more experience of that they would like to add. If you do, please type it in so that we can just read things out and share them with other colleagues who are online. We've got a question that came in advance, and it's not, as with many of these, it's not a particularly easy one, but I would like to throw it out to you, Cecilia, as for some thoughts, maybe for general discussion. Cecilia, Francesco, William, maybe in that order, if you have any thoughts about this, which is the question about when collecting information in an emergency or a conflict area, sampling. How can we come up with a sample that is significant, statistically significant, or perhaps more broadly, and how can we come up with a sample which adequately represents the reality of the population on the ground? A question which is often asked, so I'm asking you, Cecilia, any thoughts?
Yes, sorry. No, I think actually it's a very good question, but I also think that we would like to turn it around. The question would also be if it is always so important to make sure that this scientifically significant, that is, say, representative, because maybe if we are in certain situations where we have poor access to the affected areas, it might actually render impossible to be able to do a survey in that way. Of course, there's other methodologies that can be used as to get this information. But I think it was coming back, and someone was asking as well about more qualitative analysis. I think that as a system, we are shying away of using that. Maybe it's more important to find out what are the key critical issues that we need to address as a system than trying to make out a number of everything to make a quantitative analysis, which of course we would need to have a representative sample to be able to do a quantitative analysis. While if we are working more in-depth with qualitative analysis, we maybe would actually understand more about the plight of the people, their stories, but also how to address their concern and maybe in a more long-term fashion, rather than we are knowing how many people that is in need of particular deliverables, for example. So I would like to turn it around, and not saying that I have an answer to how this will look like, but I think that if we as a system is focusing more on qualitative analysis, that will mean that we can change our assessment methods in the field, and we would maybe have a broader understanding of the issues rather than a quantitative understanding.
I think that's a fascinating point. It's one that comes up quite a lot in ALNAP's work on evaluation as well, just to input that to the discussion, that there are many different realities, and qualitative approaches are used very broadly in establishing social policy in other areas of human endeavour. What's interesting is how, present company accepted, of course, how little the humanitarian world, how little work the humanitarian world has done to really understand some of these, the issues around how qualitative approaches are used in the social sciences, and some of the good practice. So ideas around, for example, saturation, triangulation, and other sort of good practices in terms of qualitative approaches could be extremely useful, I would imagine, to information collection and analysis for humanitarian purposes. And yet we don't seem to do that as much as we might. So that obviously is perhaps an area to take further. Francesco, I wonder, did you have any thoughts on this one?
Yes, what I would like to add on ACAP's side is that first of all, defining humanitarian purposes is also a bit vague, because if we are talking about the first response after an emergency, the issue is not that much on a matter of principle, but it's a pragmatic, practical issue, which is time and the fact that emergencies are complex settings, complex environments in which needs change very rapidly. So for as much as probably everybody would like to have the best information available in every situation, for the purposes of emergency response, it is fundamental being able to strike the right balance between a thorough methodology but also a good agility in changing en route and course, and a good speed to keep up with the evolution of the emergency. I think it is ACAP's belief that it is much better to be approximately right and be quick and have a good overview, even though it's not perfect, but allows to direct more or less a good response, than try to be extremely thorough, but then have a perfect picture that doesn't match anymore the needs because they have changed. I think the problem is exactly as Cecilia has already raised the point, how important it is for us to reach a great degree of generalizability and perfect sampling if this provide us a picture and data and information that is not going to be useful anymore once we have elaborated it. And I would like also to hear the points from the others on this, but I'm pretty sure this is a topic that we all know very well. I would like also to point to the fact that ACAS has produced a guide that is called the Good Enough Guide, which is a very interesting little handbook on how to perform assessment in emergencies, pointing exactly to the fact that an assessment doesn't have to be perfect, like the information management and analysis on emergency doesn't have to be perfect, but it does have to be good enough for the response. And that's, I think, is the point that we would like to raise.
I'm glad you brought that up, actually, Francesco, because it's as with many ACAPS products, it's really an excellent resource. And for those of you who haven't seen it, I would, second that it's really worth looking at some of the work that ACAPS has done around information quality and how to ensure that information is of the best usable quality. William, Francesco threw the question open to you. I don't know if you had anything else that you wanted to add on this or general area of information quality. How good is good enough? How, in particular, perhaps, can we get representative information? Do you have any thoughts there?
Yeah, thank you. I mean, I can't agree more with Cecilia and Francesco. And the answer is simple: we can't. We can't, in the environment we operate, with the resources we usually have, to get a fully representative sample. However, the logic of sampling is in itself is a great one, because when you start thinking about sampling, what you usually have, you have the end in mind. You have what story at the end of all the data I want to tell, and which part of the communities I want to look at as a specific subcategories that need a story on their own, because they would require response tailored and designed for themselves. So I think one of the advantages of sampling, even though at the end is not coming up with robust representativeness, is this beginning with the end in mind that makes data more useful and makes us collect less data than we usually do, because we narrow the focus, and we focus on the analytical part at the end. So we build it in the design of how and who we're asking questions to. So I think that's important. And there is a fantastic protection lens dimension to sampling. Because when we're sampling, we're usually forced, and over the last years more and more, to take gender, age, disaggregation as built into where we're asking questions and to whom. And that is usually coming when we start thinking about sampling. This forces itself on the way the design is happening for the discussion. And the last thing, it also forces the putting contextual analysis in place. I mean, I don't know, sampling based on proximity to major roads or to international borders or to urban centers versus rural centers. And I think just the logic of it, again, forces us to think operationally, how do we want at the end to analyze the data in order to benefit from it for real operational purposes and telling the right story. So I'm a big fan of sampling, not because it provides more rigor at the end, because it forces the right logic of building in, since the beginning in the questionnaire, the end analytical framework that is needed, and provide a beautiful platform for mainstreaming protection lens over.
Thank you, William. And you bring us to a topic which has kept raising its head, and we've so far ignored it over the past hour. But I think we probably can ignore it no longer, because it does seem to be a sort of a slightly different level of question, but a big one, which is about this point that all three of you made, that the information really has very little value in and of itself. I'm paraphrasing, but the information exists to support decision making. You have to decide what information you need. You have to have some kind of idea of what decision makers need to know. Now, discussion, I think, particularly within the clusters, as to whether currently the cluster information management and information management in humanitarian architecture more generally is getting that quite right, and particularly whether the sort of information that's being collected is actually useful for operational decision making, on the ground, or whether the information that forms the core of the information management function is more useful at a strategic level for high-level advocacy or for high-level fundraising. Francesco, I wonder, from your experience, what you think. Do you think that there's a need for information management systems to focus more on the operational side of information? And if so, or to the degree that there is, how would they know what they needed to get for operational purposes? How might they identify what information was needed then?
For what concerns us, I would like to say I would prefer not to talk about the work that clusters are doing, because that's way more operational, and I'm sure that this is more for my colleagues actually in the UN system and involved in actually coordinating the InterCluster and working with clusters directly on this. On our point of view, though, what we can say and we can see when we work dealing with the information that is available and the information that we need to assess, we notice that there is really a lot of attitude towards there is a habit to actually invest a lot of effort in informing the decision makers and informing up, which is good. But it's sometimes it's too much, and that goes to detriment of the more operational and logistical concerns of probably of the organization on the field. And I think that on our perspective, sometimes it's also possible for everybody to see that there is a lot of what we call noise, in the sense there is really a lot of reporting, and sometimes this is like creates more confusion than everything else, exactly because of this approach that is like focused a lot on informing above, and this can end up fostering a little bit of confusion in the system, and also for the people that are actually then looking for information that they need for operational purposes. There is a lot of documents to read and to dig into before finding sometimes the information that is needed specifically.
Thank you, Francesco. So a lot of noise, a lot of information around, the information maybe not always meeting the operational needs in some circumstances. I wonder, have you any experience of, if you were in a situation where you were sort of developing information management system that was focused on those operational needs, focused on sort of response needs, any ideas about how you might go about it? What sort of tools or approaches you might use to identify really who needed to know what? Is this something that you've worked on at all?
This is not my main function, and is not exactly our main mandate, because we prefer to stay more on the need point of view, and of course the informed decision maker, and we leave the more response side of the information to other agencies. So I would prefer to turn the question to OCHA, because I'm pretty sure that's something that they deal with every day, and I'm sure they are in the best place to answer.
Great, thank you, and fully recognize, by the way, everybody, that because of the breadth of things this webinar is covering, not everyone is an expert in all of them. So thank you for so graciously telling me to move on, Francesco. William, maybe as OCHA has been queued up here, we could take this to you. To think about, first of all, what do you think about this balance between operational and strategic? And secondly, how current information management systems might collect more operational information while still, fulfilling the other functions that they're expected to do. Any thoughts on that?
Yeah, thank you. I mean, to me, it's pretty simple. Information systems should only be operational. I mean, that's the main focus, and this is where it's useful. It has to be actionable for operational partners to use it. The strategic level should be a byproduct of the operational data, and it should come more from analyzing and aggregating up operational data. And with this way, the serving more the big picture doesn't become cumbersome for the field level partners, nor becomes the center of attention. It's very important. I mean, we all recognize how important it is to look at the strategic dimension. But I think the challenge becomes when data collection is designed to service strategic objectives only, and this creates frustration, creates collection fatigue, and basically it flips the logic in the wrong direction. So I think what should happen is that data collection processes should be only guided towards operations. What should be complemented is an analytical framework of aggregation of this data up to provide the big picture. Needs to be thought through since the beginning. How are we bringing it all together and serving kind of the strategic decision-making level? And to do that, again, we go back to really the basics, to basic definitions, to data sharing, to the concept of timeliness and data cycles that are beneficial for the timing of strategic decision making. So I would say for this to happen, I think what it takes mature and operational information management systems where standard definitions are in place and where we create the time and the capacity to analyze in an aggregate way that provides a good enough picture for decision makers at the end. Over.
Thank you. Because I mean, one thing that that many people have said to us in our work around coordination, information management, is that currently the mechanism is almost established the other way around. In order to sort of collect information required for the for things such as the humanitarian program cycle and so on, in order to collect this strategic level, response-wide information, most of the information management energy and time, if you like, goes towards that rather than to more operational work. I wonder if you have examples, and this is always, of course, going to be attention. I wonder if there are any examples that you know of what you're speaking of a more operationally focused approach to information management, where the strategic piece is, as you say, almost a byproduct. And if so, what someone wanted, or people were interested in establishing a system like that, what advice might you give them for sort of building up from operational?
Yeah, thank you for unmuting me. I mean, eventually, let's take the humanitarian program cycle. I mean, the humanitarian needs overview basically asks pretty simple questions. How many people are affected? How many are IDPs? How are they disaggregated between in age and sex and location? And for every sector, they basically have to say what are the priority needs and how many people in need are per location. So the answers, the questions to be answered for a humanitarian program cycle are pretty basic. You can't run a cluster approach or program or intervention without knowing these basics. So what we do, for example, in the context of the Syria crisis, is we recognize that the HNO is at best 40 pages. We try to make it even smaller for people to actually read it. What will eventually go for a operation as complex as the Syria crisis or the Congo crisis or Ukraine is 1 page, recto verso per sector. And there is so much information you can put there. It's pretty limited, it's congested, it's analytical in nature. What we do, however, is for every sector to come about with their analysis, is you have a kind of a discussion process, interactive analysis between the members of the clusters that have to sit and debate with each other. And if you take last year's HPC for the Syria crisis, yes, we have an HNO that is beautiful and quite sharp and well thought through and built on evidence. But what we have is, in addition to it, we had a full protection report that came on the side of the process that is so rich in nature for program partners. We have a GBV standalone also resulting from the process. So the amount of data that was collected for operational purpose was so big that just a slim part was used for the HNO, but the rest was used for actual real programmatic analysis between partners, but also documented in documents that are much more rich and interesting for operations for the HNO. And I think the least we focus on the HPC as a product, but more as an analytical and interaction process between operational partners to figure out what they want to do next year and how they want to do it, the better it is. Over.
Great, thank you, William. Same question to you, Cecilia, because this is such a sort of fundamental question that does seem to come up a lot. How do you think information management systems, or what is your experience also of information management systems collecting more of the operational information while still supporting, obviously, the HNO and the HPC and so on?
Yes, no, I would say that William really put it in the way that I also would like to see in the concept of it. So basically, the strategic level will be an aggregation of the operational level, and I think that's where it's coming down quite a lot of responsibility on the information management officers in the clusters to actually having a bit more of a proactive approach. Of course, as well the coordinator, but now we talk on the IM side. But having a more interactive approach, because we all know that in the humanitarian program cycle, certain of the processes will start at a certain point and finalize in a product in another time. And basically, it's more or less yearly, so we know when it's happening. But just as William as well was saying, that for us on the operational level, and also strategically, I would say within the cluster, we need to have a much more detailed understanding, which is updated along the year. So the cycle is really a cycle, and it's not a yearly cycle. It is an ongoing cycle all the time. So every time there's a change of the situation, then as if I'm working with early recovery cluster that I was in Nepal, then of course I need to be on top of understanding what does that mean for our strategy. Do we need to change our strategy? What does it mean for our partners' operational context, etc.? So in that sense, we can use the same tools that we are using to support the HPC. For example, the 4W that I know every information management officer well aware of can of course be set to be much more operational than what is needed for actually feeding the HPC and the need of, for example, in the monitoring side. So I think that it is about thinking ahead and knowing. And I think here maybe what is the problem, and we often are feeling that we are feeding more upwards than down, is there's a lot of ad hoc requests, and we are not always sure when we will need to provide what information. So I think that to help this would be really good if OCHA could, for example, in the beginning of crisis, rather not OCHA, the HCTs should sit together and then deciding on a calendar for when they're going to need certain of the aspects for the humanitarian program cycle. And then based on that, each of the cluster will then define their own process of how they are going to support that part, but also how they can use the same tools and the same processes to get more detailed and operational information that then they can produce other products. So as it stands at this point in time, I think that the biggest problem is that most of the products as it developed is for a decision-making audience rather than operational. But often we do have the information gathered on the level that it's needed for operational discussions and decisions. So that is where we then need to ensure that we have the time to actually produce this information as well and make it available for the cluster partners, local governments, etc. So actually decision-making can be taken on that level as well.
Very useful ideas there. Ideas about on collecting information as you go along, rather than doing it in one great big sort of annual piece. Ideas about ensuring that the product as well, because this is something that one sees a lot. That the product, as you say, Cecilia, pointing upwards, not pointing outwards necessarily. So a lot to think on there. Francesco, I think you had some thoughts you wanted to add.
As I would like to say, it's also, I think I find it very insightful and useful what my colleagues have mentioned, and I think it would also facilitate the work of ACAPS, because what we do is, our work is to inform decision making, and I think we are an organization that has made of this its main mandate. Well, it's not the only thing we do, but it's our main mandate, and it would be good to have available the adequate operational information that is key on point and synthesized enough and practical enough, because then to analyze it and propose it for decision makers, there are several possible different analytical frameworks that can be used. And it sounds like it is possible to integrate two processes that are and it's possible to use the operational data to develop good information for decision makers, but it requires the right approach, it requires the right use of the framework, people that are trained for it. So I think it's, I find it very interesting, the point that it is, I'm sure that if organizations focus on developing even more precise and more effective operational information, that will be beneficial also for all the other actors in the humanitarian sector that have different key roles. I think it's it would be like having better building blocks or bricks to build more resistant and high walls, in my opinion, if we want to use this metaphor. I think it's a very good point, and I would thank also my colleagues for their input. I find it very interesting.
What I would say is that this issue, I mean, it's such a key issue for so many of the ALNAP constituency that if anyone taking part in this webinar has really good examples of how this has been done, of how information management systems within a cluster or within the architecture more broadly have focused on answering operational questions but have simultaneously been able to provide the strategic level information, do please send information to us so that we can include it in our sort of roundup and an ongoing research on this topic, because it's an issue which I think is of great concern to many people. William, are you able to speak?
I mean, I just wanted to add is that over the last 5 years, probably, we had several information management initiatives like ACAPS, like REACH, like IMAP, JIPS, Map Action. All these kind of information management focused initiatives are great to capitalize on in situations where, if the focus is on operational data, the challenge is often how do we digest it? How do we aggregate it? How do we make sense of it? And the collaborations of sectors or intersectoral level with these initiatives that can help to a great degree in bringing professionalism, but also an additional capacity to the operational response in digesting the data and transforming operational data to an aggregate level strategic data encourages, I think, the clusters to focus on the right things and on the operational data only. Over.
Thank you very much, William. And I think just a point that sort of is reflected here for me, which has come up also in our research quite a lot, and goes back to something that Cecilia was saying earlier, is that it's easy to over-focus perhaps on the information product, whereas actually the information process can also be extremely important for cluster members and for the broader humanitarian sector, and that we probably do need to consider the value that's being created by the actual processes of working together around things like harmonized analysis at the operational level as well. We are coming to the end of our time, and which is a shame because there are a whole load more things to talk about. I don't think we'll get to them today, but this is a conversation that remains open. What I'd like to finish on is I would just like to ask each of our expert panelists to reflect on any final thoughts that they have, particularly any final thoughts that they have around how going forward the sector might improve information management. If you had a magic wand, what are the sort of things that you would focus on addressing? And can I go perhaps first of all to Cecilia?
Yes, of course, if I have a magic wand, a lot of things I wanted to fix, particularly that we have better information very early on in an emergency, but obviously with a lot of preparedness that is happening right now, preparedness initiatives, there might be a possibility for that, so that's very exciting to see. But the other thing that I think maybe would be key is maybe to change the way that we're doing business in the field. My feeling is that we do have on the level of global level guidance, we have quite a lot, but a lot of that has actually not really been practiced in the field, and we need to change the way that we are basically doing our business there. We need to have, as I also mentioned in the beginning, a much more of a discussion between information management and coordinators or program, depending on if we are working in a cluster or even inside an organization. Because I think that in many situations right now, information management is basically doing its own products for the product's sake sometimes, while the coordinator might not always see how they're going to use that for informed decision making, and that linkage is not really there as well as it should be. So I think what is needed now is basically that the coordinators and program people need to be better clients. They need to think about what would be useful for them, so they can then help and direct more where the information management processes and then products is going. And I think that is, I often see that as a missing link in the field.
Thank you. So the challenge there for all of you taking part today who are information managers or in the information management process is helping your decision makers to be better clients, helping them clarify what they need from you. So good luck with that. But thank you very much. I think that's a key point and a fundamental point, Cecilia, that's run through from the beginning of the session. William, if you had a magic wand, what would you do with it?
Well, I mean, I would go very, very simple. I would say in operation, just get the basics right, share data, and be humble about the limitations and how much we don't know, and we rely on real expertise to make decisions based on partial information. And I think just getting these three right makes life easier. Over.
Thank you very much, William, and getting the basics right. Thank you. Francesco, your last but by no means least, your magic wand. What would you improve as a final thought?
I would like to take what William said, that I completely agree. And if I could, I would use my magic wand to increase the awareness and the humbleness and the knowledge on how to do IAM and how to do analysis in all the parts that participate to the IAM process. Because, as William said, being humble, providing the data, sharing it, and recognizing where the limitations are goes actually a long way for people to understand the point of view of the data collectors and the analysts, and allow for discussion. Agreeing or disagreeing allows for discussion and allows for moving forward. So great transparency in the methodology, focusing on basic information but in the most effective and rapid way. This, in my opinion, can go a long way in also facilitating the job of organizations that, like ACAPS, focus on making sense. And my last recommendation will be always remember and try to be, when responding to an emergency, try to be approximately right instead of being precisely wrong. Be simple, be basic, share the methodology, share the shared data, and this can be hugely beneficial to the humanitarian sector.
Thank you, Francesco. I think that's a marvelous way to end. And as we are approximately, if not exactly on time, I'd like to end only by saying, first of all, thank you very, very much, Francesco Fresetti, William Cemali, Cecilia Utas, for giving us your combined experience around some of these questions. I've found it really very, very useful and informative, and I hope that all of those who've participated have as well. Participants, I'm sorry we didn't get to all of the questions. Thank you so much for giving your time, an hour and a half to this webinar. The webinars are very much for and about and by this community, and so we really do appreciate your participating. And if you have any ideas or around this topic, do please share them with us, and we'll find a way to magnify them and get them out more broadly. So from here in London, thank you very much, and have a very good morning or afternoon wherever you are.